Hey guys, today we're going to talk about something that the majority of us had to suffer through at one time in our life or another, and some people it happens recurrently with that. And that's cold sores or fever blisters. They're very, very contagious. They occur outside of the mouth, on the lips. They can also be seen on the nose and the chin as well. They can be single blisters, or they can occur in clumps where several blisters will be forming together. They're tiny, fluid filled, and what happens is the blister will appear. You'll actually feel like an itching sensation, a little pain. The blister then comes on, it will pop, then it will scab over. And it can take anywhere from 2 to 3 weeks from the point of appearance till it goes away. During that time, any time that the blister is fluid filled, you are contagious with that. And you really want to be careful, because sometimes even when they're scabbed over, you may have another blister beside it or close to it that is not, making you still contagious. And with little kids, that's where a lot of it comes into. Now, with this, it's caused by the herpes virus, herpes simplex. It's spread through person-to-person contact. Main source is kissing, and it can occur from sharing glasses, pops, cups, toothbrushes. If you happen to do that, you can get it that way as well. So you want to make sure that if you have this, that you're not sharing anything with anyone else, because it is so contagious. There is no cure for it, but it is treatable. What happens originally with the symptoms, you will feel, like I said, the tingling or itching coming on before it actually occurs. It's at this point, when you initially feel that tingling coming on, that if you were going to be treating it with a prescription drug like valcyclovir, which is Valtrex, or acyclovir, which is Zovirax, or famciclovir, which is Famvir, it's at that point that you want to start taking the medication. If you don't have the medication and you know from past history this is going to occur, this is the time to talk to your provider about it, to get a prescription for one of those medications. The blister will then start to appear. It looks like a little pimple. The blister will form, and then as it pops, it will scab over and again take 3 weeks. You can see in bad cases high fever, pain, sore throat, headache, pain in the inside of the mouth, in the gums, and even in your teeth because of the pressure that can occur with that. The other thing you can see in bad cases is muscle aches and joint pain. That will really occur if you've never had it before and you have a bad case. Generally, the first time that you get one of these cases is when you will see the muscle and joint pain with it. In kids that are less than 5 years of age, you can also see cold sores in the mouth. In adults, that is not a cold sore. That is a canker sore. But in kids less than 5, cold sores can appear in the mouth. And really, again, I've got grandkids. You really want to watch out when they're around other children, because they share items, and that's when they're going to be transmitting that to other kids. A reoccurrence can happen very easily once you've had this, because that herpes virus, after it has gone away and it's healed, lies dormant in your system. Now, what brings it back out? Fatigue, if you're not getting enough rest. Stress, which good luck. How are you going to cut back on that? Hormonal changes as you're going through, as a female especially, as you're going through your period, you're going to be more prone to have those. If you're out in the sun or the wind, it can cause an outbreak to occur, because your tissue has been weakened by the effects of the sun and the wind. Thereby, you're going to be more prone to getting those fever blisters again. And then the other thing that can happen is if your immunity goes down from another infection, you get a bad cold, you get the flu, something like that, it can bring on fever blisters as well. Probably also because of stress that happens when you do get sick. Now, as far as complications from this, you can see an eye infection. Again, you want to be very careful because the herpes virus is also what you deal with shingles. Well, in that situation, if you get it in your eye, it can cause vision loss. So you really have to watch out. People with eczema also can have severe outbreaks when they start getting blisters. But with that as well, as your immunity wanes, as you're not getting enough rest, as you're under stress, you're more prone to an eczema outbreak too. So it's kind of like a double whammy for those poor folks. The other thing with people with eczema is they are another individual that can see outbreaks of cold sores occurring other than on the lips, the nose, and the chin. It may be in areas where they're having an eczema outbreak as well. So it's really important when you start feeling one of those fever blisters to come on that you talk to your doctor about getting a prescription for an antiviral. Everyone is at risk for this. That's why, like I said in the beginning, most of us probably have already dealt with this problem at one time or another. However, people with HIV or AIDS, organ transplant recipients, cancer patients, again, people with eczema, and patients who are at risk of having their immune system compromised for other reasons are more prone to do this. So things that you can take naturally to help prevent this are things like vitamin C, 500 milligrams a day, and vitamin D as in dog, 2,000 units once a day. That will help boost your immune system. As far as prevention, you want to avoid, obviously, if you or your partner has got fever blisters, avoid kissing them. It transmits very easy. And also avoid sharing products where your lips are going to come into contact with it, cups, mugs, things like that. Other thing you can do for prevention is to make sure you wash your hands with warm water and soap, because unfortunately, I have to do this all the time. I don't have to, I just do. If you happen to have a fever blister, guess what? It gets on your hands. Then you can transmit it. If you do this, that's how you get the eye infection that I talked about earlier. Now, as far as treatment, there are topical antiseptics out there. Then there are some creams like Abreva, which is effective, and some oral treatments that just treat the pain. They don't treat the cold sore itself, like Ambisol would be an example of that. Antivirals are your best source of treatment. And again, when you first feel that tingling, itching feeling that's going on that occurs prior to the fever blister showing up, that's when you want to start with your medication. They do have antiviral ointments out there, but they are not near as effective as the oral tablets. Acyclovir is a great example of that. The ointment, number one, it's more expensive, but it is not as effective as the tablet, so it'd be best to get the tablet. You need to keep the area moisturized, but remember, if you touch it, wash your hands. But especially as it's scabbed over and it's starting to heal, keep that area moisturized. And if you're using lip balm, which if it's on your lips, that's what you want to do, after that area is healed, throw that lip balm away because it's compromised. You don't want to use it again, and you don't want anyone else to use it. That's how it gets passed around. And then also, like I said, vitamin D, vitamin C will increase your immunity. And then something else that you can take is lysine. It comes as 100 milligram capsules. It won't treat the actual cold sore, but it will help prevent it. And I said 100 milligram, it's 1,000 milligram capsule once a day. And you just take it on a daily basis. It's a supplement, no major drug interactions or side effects with it. But if you're finding that you're getting these cold sores recurring, that would be a go-to for me.